Good day, everyone. On behalf of Ausnutria Nutrition Institute, represented by my colleague Lucie van der Zee, Research Manager Nutrition and Processing, and myself, Anne de Mink-Marsman, Global Nutritional Brand Manager, I would like to welcome you to this webinar. Before we introduce ourselves in more detail, I would like to give a warm welcome to Professor van der Plas. Welcome. Professor van der Plas is from the Kids Health Castle University of Hospital of Brussels, and we are very happy that you could join us today.
You're welcome.
Today we talk about a new publication. This publication is focusing on a survey which is done with Middle East and North African doctors. And this survey is focusing on the difference between cow milk allergy and cow milk intolerance. Next to this, also the paper focused on the potential role that goat milk could play in infants that are suffering from GI-related symptoms. Before we discuss the results in more detail, I would like to introduce our company, Ausnutria. Ausnutria is a Chinese-Dutch company. We produce healthy, high-quality nutrition, dairy products, and mainly focusing on infant formula. We do have our mother organization in Hong Kong located. Also, we do have joint ventures from over the world. Ausnutria is a brand owner of Cabrita. Cabrita is a goat milk-based infant formula. With Cabrita, we combine the gentleness of goat milk in combination with a modern formulation. Cabrita is the main focus of Ausnutria, the Netherlands. So, Ausnutria has launched 1.5 years ago the Ausnutria Nutrition Institute. The Ausnutria Nutrition Institute has a clear objective, that Ausnutria will be recognized as a science-based company. We build brands on sound science, share knowledge, and collaborate with experts from over the world. Our institute has a clear field of expertise, goat milk and goat milk formula. With Ausnutria, we try to educate and to inform healthcare professionals from over the world about the unique and natural benefits of goat milk. And, of course, the scientific substantiation of our brand Cabrita. We do work together with hospitals, universities, and also independent research institutes from over the world. But next to these collaborations, we do also have our own research departments that really focusing on all the natural benefits of goat milk. And for this, I would like to give the word to Lucie, who can explain us more about the research program within Ausnutria.
Thank you, Anne. Yes, I'm the research manager of the Nutritional Sciences and Processing team within Ausnutria, the Netherlands. And with these teams, we are focused on the characterization and understanding of the functional benefits of goat milk and goat milk-derived infant formula. People often ask me, why goat milk? Well, of course, we know that human milk is the best source of nutrition for infants, but sometimes this is not possible. And therefore, we need high-quality alternatives. These high-quality alternatives need to be as similar as possible to human milk in terms of composition and performance. Well, studies have shown that goat milk is pretty similar to human milk in terms of composition. It naturally contains oligosaccharides, it contains nucleotides, and also the fatty acid profile is pretty similar in contrast to cow's milk. In terms of performance, we have seen that upon digestion, goat milk forms a looser curd in the stomach, which is more similar to human milk, and therefore induces easier digestion, as we call it. This similarity with human milk also has the benefit that it needs less manufacturing when you try to make a humanized infant formula. In our research teams, we focus on the composition and functional benefits of goat milk and goat milk-based infant formula. And we have identified two main focus areas, which is the digestion, GI comfort, and growth, and on the other hand, intestinal health and microbiome, which is closely related to immunity. And in the past, we already have shown that Cabrita, our brand, is safe and well tolerated by infants. It has a digestive profile similar to human milk, saying that it is digested as fast as does human milk. We even have results indicating that children sleep better and more on Cabrita and even may cry less. And our latest results indicate that infants with mild GI complaints, saying a co-milk score between 6 and 12, recover faster when they're fed with cabrita than fed with a cow milk product. Okay, focusing a bit more on the GI complaints. We got quite some questions from consumers, but also from healthcare professionals, whether in the case of infants suffering from GI complaints, whether goat milk could be a suitable alternative for cow milk in infant nutrition. We all know that common dairy-related GI disorders complaints are CMA, cow milk allergy, and CMI, cow milk intolerance. And although these two disorders have a similar presentation, they differ in etiology and prevalence and also need a different treatment. And it is important that the healthcare professionals make the correct diagnosis because the treatment options depend on that. We had a feeling that it is difficult to discriminate between CMA and CMI, and that's why we thought maybe it is good to investigate the awareness of the healthcare professionals between these diseases and whether they are aware of the treatment options. And that's why we thought it was good to conduct a survey, in this case in the MENA region, the Middle East, North African region, to identify whether healthcare professionals were aware of the treatment options, of the prevalence, and these kinds of things between CMA and CMI. The first step was, of course, to establish a group of experts in the field. And today, we have invited Professor Dr. Yvonne van der Plas in the studio to tell us all about how we set up the survey and tell us about the outcome of the survey. And I would like to start with a small question.
Yes.
Could you immediately see the importance of such a survey?
I think what is important is what was done is to collect information on how in that region of the world healthcare professionals recognize or not recognize the difference between functional gastrointestinal disorders, intolerance, cow's milk protein allergy, and how they diagnose and handle it. So it's collecting information on how today those children with these frequent problems are diagnosed and managed, and then based on that information try to see if further education is necessary or not.
Yeah. I think we all agree that this is a very important topic to have a better understanding of. And therefore we are very curious, looking forward for that you could share the results with us. So I would like to invite you to the presentation deck and share with us the nice study design and also important results and conclusion of the paper.
Okay, with pleasure. My pleasure to do so. So the goal of today is to present you the paper that was published some months ago on how in the Middle East and North African region infants presenting with functional disorders with frequent symptoms are managed, are diagnosed and are treated. So it's all about gastrointestinal symptoms in early life. So the agenda, what we will discuss is about cow's milk disorders, allergy, intolerance, prevalence, and then the main part is the outcome of that survey that was done in the Middle East, North African region. Present you then some typical properties about the usefulness of goat's milk infant formula in the management of these infants, and then come to conclusions. Before anything, it's of course important to remind you that breastfeeding is the best way to feed all infants, and that every effort should be made to stimulate breastfeeding as much and for as long as possible. However, on the other side, it has to be acknowledged already also that not every infant can be breastfed exclusively for 6 months. And so the non-breastfed infant certainly has the right to get as much as possible the best second choice infant feeding. But those infants which are formula fed very frequently develop functional gastrointestinal disorders. And as you can see, 80% of the clinical visits in early life are due to gastrointestinal discomfort. And it's mainly reflux symptoms, regurgitation, and defecation symptoms, constipation, as well as loose stools, and general manifestations such as irritability, distress, crying, which are the main reasons why mothers go to consult healthcare professionals. So the majority of infants suffer from minor gastrointestinal disturbance, but it's not because they are minor that they do not have an important impact on the quality of life of that infant and of that family. And that's why those minor digestive symptoms also deserve to be taken care of and to be managed, which are the most frequent gastrointestinal disturbance. Well, as said, it's 23% with regurgitation, 21% with colic, 18% with constipation, resulting in already more serious problems of failure to thrive in 15%. Altogether, it's more than 1 infant in 2, it's 55%, which present with those minor functional gastrointestinal disorders. So proportionally, it's 50% of the population of infants which presents with functional gastrointestinal disorders. And yes, they disappear over time. So it goes away, but nevertheless, they do have consequences. Consequences on the short term, because they introduce feeding difficulties. So functional disorders is often a reason to stop breastfeeding, which is, of course, not indicated at all. Functional disorder is not a reason to stop breastfeeding. But the mother feels insecure, that causes parental stress, that causes depression, that causes insecurity. And what has also been shown is that those functional disorders are related to behavior and developmental changes. So a family which had an infant with a functional gastrointestinal disorder, the quality of life in that family 3-4 years later is still less than a family who had an infant without a functional gastrointestinal disorder. So that's why taking care of those families in which there is an infant with a functional disorder is of importance, because it has major impact on the quality of life on the short term and long term for that infant and for that whole family. Now, becoming more scientific, allergy or intolerance. What's the difference? It are all adverse reactions to foods, but some of them are immune mediated and then they are allergy, or some of them are non-immune mediated. And today we will not really focus on the allergy, which can be IgE mediated, which is relatively easy to recognize, but also non-IgE mediated allergic reactions do exist, and that's much more difficult to recognize, much more difficult to diagnose, because there is no specific diagnostic test. But you have also non-immune mediated adverse reactions to food. And that's what we are talking about today. Those reactions which are not related to a reaction of the immune system, but still causing symptoms. And that are the functional gastrointestinal disorders. So what's the definition of cow's milk allergy? The scientific definition is it is a reproducible, clinically abnormal reaction to cow's milk protein due to the interaction between one or more milk proteins and one or more immune mechanisms. And that's a very nice scientific definition, but in daily clinical situation, you're not really much helped with this kind of a definition, because there are many different proteins, there are different immune mechanisms, and in fact we can only measure IgE-mediated mechanisms. So it's the scientific definition, but which certainly has no real-life clinical impact in all the situations because of lack of diagnostic possibilities. And cosmic protein allergy does cause a lot of symptoms in the respiratory tract, in the gastrointestinal tract, skin, general manifestations, and systemic reactions. And in fact, anaphylactic shock is the only typical symptom of cosmic protein allergy. All the other symptoms can also be caused by other diseases, other etiologies. So diagnosis of cow's milk allergy is difficult because there is not one specific symptom. And all those symptoms can be caused by other mechanisms. And so, especially for the focus of today, the gastrointestinal manifestations and the general manifestations of crying and distress, and so regurgitation and defecation problems, it's for the healthcare professional often very difficult to make the difference between what is functional and what is IgE-mediated. So skin prick test and blood sampling with IgE and specific rest can be helpful in the diagnosis of cow's milk protein allergy if it's an IgE-mediated reaction. But at least half of the reactions are non-IgE-mediated reactions. So both tests can be done, but they need to be done in addition to a diagnostic elimination diet, because that's the golden standard. You take away the protein causing the reaction, the infant gets better, and then you need to challenge the infant again. But of course, in a functional gastrointestinal disorder, the same will happen. If you take away the offending protein, the reaction will disappear. You challenge again. So the golden standard to diagnose cow's milk allergy, elimination diet and challenge test, does not make the difference between an allergic reaction and a functional disorder. In order to try to get more information and to help healthcare professionals to get better aware of possibility of cow's milk allergy or not, we developed with a lot of colleagues the COMI scores, the cow's milk related symptom score. And what it does do is it takes together, it groups together different symptoms caused by cow's milk allergy: crying, regurgitation, stool composition, skin manifestations, and respiratory symptoms. And it gives a certain weight to those different symptoms. It goes from 0 to 33, and we published this score for the first time some 7 years ago. In the meantime, 25 studies have been performed with this score, and the review of all this information is just being submitted for publication. So it's a widely used score which has been shown to have not too bad sensitivity and specificity, about 70 to 80% for the diagnosis of cow's milk allergy. But it's not a standalone diagnostic tool. You still need the elimination diet and challenge to confirm the diagnosis of cow's milk allergy. But it's a helpful awareness tool with, as I said, sensitivity, specificity of 70 to 80%, which is much better than any other test existing today. So what is the incidence of cow's milk allergy? Well, in breastfed infants, it's relatively rare. It's less than 0.5%. And in formula-fed infants, the incidence of cow's milk allergy is less than 5%. According to literature, it's between 2–7%, but most studies give you an incidence of 3 to 4%. So less than 5% of the infants have cow's milk protein allergy. Remember the incidence of functional gastrointestinal disorders. That was 50%. So cow's milk allergy is difficult sometimes to separate from functional disorder. But the prevalence of both conditions is quite different, why functional disorders are 10 times more prevalent than cow's milk protein allergy. So cow's milk intolerance versus cow's and gastrointestinal symptoms associated with cow's milk intake. So cow's milk intolerance or gastrointestinal symptoms associated with cow's milk differ from cow's milk allergy as they arise from the body's inability to digest specific components of cow's milk such as protein, lactose, and fat. And that's different from an immune-mediated reaction. This is about inability to digest some of the compounds. Now, what about lactose intolerance? That does almost not exist in the population we are discussing today, which are young infants, because mother's milk is full of lactose. Lactose is the most prevalent component of mother's milk. Of course, nature has been taking care of that. So since breastfeeding is the recommended feeding, it's obvious that infants will tolerate lactose. And the lactase activity is highest immediately after birth, which is very important because that human milk is the only food source of the infant. And lactase deficiency present from birth is extremely rare. There are about maybe 12 case reports which have been reported in literature, but that's it. And most of them are from Finland and Western Russia. And it's a very severe diarrhea from the first days onwards. But I've never seen it, and probably it's so rare that the majority of us will never see it. So we are not talking about lactose intolerance because, as I said again, primary lactose intolerance at this age does in fact not exist. But we are talking about intolerance to proteins, difficulties in digestion of cow's milk-based infant formula. And that's why we conducted this survey to identify the current management of cow's milk disorders and the role of goat milk-based formulas in the Middle East and North Africa region with a whole group of colleagues, and my role was to coordinate that and to analyze the results and the outcome. So the aim was to evaluate physicians' understanding of the prevalence, diagnosis and management of cow's milk allergy and cow's milk intolerance, not lactose intolerance, in the Middle East, North African region to identify the role of goat's milk-based formulas in this management. So the methodology was, we did the literatures, we had that expert meeting with 13 pediatricians, what you heard already about. We developed the survey with 17 different questions. This was sent to healthcare professionals electronically. 2,500 were invited, and it was an online survey, and we get quite good response of almost 1,900 colleagues. So this is information of about 1,900 healthcare professionals about how they diagnose and manage cow's milk intolerance allergy. So what is the outcome? First, some general information, years of experience. You see that that was nicely distributed as well. Very experienced colleagues as young colleagues. It's 1/4 for each of the different groups. Also male, female was equally more or less distributed. The country majority came from Saudi Arabia, and you see proportionally the other countries, and you see also that the vast majority were general pediatricians, and that's of course the information we are most interested in, how general pediatricians handle this kind of frequent problems, because it's at that level that these mothers go to seek help. It's not immediately at university level. They go to the primary healthcare level. They go to the family doctor. They go to the general pediatrician. So what was the outcome? This question asked for the prevalence of cow's milk allergy in the MENA region, which is between 1 to 5% according and in consistency with the prevalence in Europe and the prevalence in China. So cow's milk allergy, 45% said the prevalence was 1 to 5%, and then 6 to 10, 11 to 20, you see that it goes down. 16% said they had no idea about the prevalence of cow's milk allergy. And for intolerance, it's 31%. 1 to 5% said it was 30% of the infants. 6 to 10% said 20% of the infants. And 11 to 20% said 30% of the infants. And exactly the same as for cow's milk allergy, 16% said they had no idea about the prevalence of cow's milk intolerance. But in fact, you see that the figures are not that different between allergy and intolerance. And remember, according to epidemiological data, allergy is 10 times less frequent than intolerance. So how do our colleagues differentiate between cow's milk allergy and cow's milk intolerance? The majority did understand the pathophysiology of both mechanisms. And 80% indicated that cow's milk allergy and cow's milk intolerance are different disorders. How to differentiate? 35% with elimination diet, diagnostic elimination diet, and challenge test. 5% ask or skin prick test. 30% does blood sampling with IgE, specific IgE, and 30% did not really answer and said they had different opinion according to every individual infant, so they had no straightforward protocol on how to handle infants with those frequent problems. Diagnostics in suspected cow's milk allergy. A third of the MENA-based physicians do not follow the national guidelines to diagnose cow's milk allergy. So requesting IgE tests, you see that 30% never ask for it, and 10% asks for it in the majority of the infants. But so how frequently they ask for IgE testing is very different from physician to physician. In fact, guidelines also have no clear recommendation to do IgE. Most of the guidelines say you can do it or you do not do it. It depends on the local situation. So treatment in practice. What do you do? So for cow's milk allergy, lactose avoidance is still recommended in 3%. And for cow's milk intolerance, lactose avoidance is recommended in 30%, while we said that for the majority, 99% of the infants or even more, lactose intolerance at this age does not exist. What about the therapeutic formulas? For cow's milk allergy, 30% extensive hydrolysate, almost 50% amino acid-based formula. So let's say that's 80%, which is, of course, the recommendation according to the guidelines to treat cow's milk protein allergy. It's with an extensively hydrolyzed formula or with an amino acid-based formula. 17% uses goat's milk formula, and we will come back to that later. For cow's milk intolerance, it's 23% with extensive hydrolysate, 17% with amino acid-based formula, and 26% goat's milk formula. And for cow's milk intolerance, since it's not an immune-mediated reaction, hydrolyzation of the proteins is not really necessary for that management. So what's the potential role of goat's milk infant formula? 65% of the colleagues are aware of the nutritionally adapted goat's milk infant formula, know that goat's milk-based infant formula is nutritionally completely safe and adapted to the needs of the infants. And then the question was, would you recommend routine use of goat's milk formula in infants? And you see that 37% says yes, 25%, 23% has no opinion, and 1/3 says no. What role could goat's milk infant formula play in the management of cow's milk associated symptoms? That's of course the major question. Regarding allergenicity, limited data. There is discrepancy in the conclusion regarding the allergenicity of goat's milk versus cow's milk. But discrepancy saying that goat's milk is maybe a little bit less allergenic or equally allergenic. But there is also literature that there is a high cross-reaction between cow's milk and goat's milk proteins. It's over 90% of the children with IgE-mediated cow's milk allergy will react to goat's milk. And goat's milk allergy occurs without cow's milk allergy reported up to 26% in one study, but that's very high and I don't believe that. But it certainly exists that children develop goat's milk allergy even when they were not allergic to cow's milk. But cow's milk allergy without goat's milk allergy is also existing, of course, because it's only 90% which has a crossover reaction. So 7 up to 10% probably of the infants with cow's milk allergy will tolerate goat's milk. And of course, in an individual basis, changing cow's milk to goat's milk will work in 1 infant in 10, but that's of course much too low to recommend. So you cannot use goat's milk-based infant formula in the case there is cow's milk protein allergy, because the crossover allergenicity is too high. So goat's milk infant formula is not recommended for children with a confirmed diagnosis of cow's milk protein allergy, which means you need elimination diet and positive challenge test. A few case studies showing the better digestibility of goat's milk infant formula. So case studies have been published in infants with gastrointestinal complaints reporting improvement in stool characteristics, crying time, and overall gastrointestinal comfort. And goat's milk toddler formula has been shown to reduce the symptoms associated with cow's milk consumption, and that has been shown also using the COMI score in a clinical pilot trial which was performed. So it's a randomized controlled clinical pilot study using it in one arm standard medical treatment with a formula containing a probiotic, Lactobacillus reuteri, and cow's milk infant formula, and goat's milk-based infant formula in the other arm. So it's small groups, it's 7 infants compared to 9 infants, but at baseline, COMI score was done, growth of those infants was followed, and the quality of life of the mother was taken. A diary had to be filled in during 2 weeks, evaluating also quality of life. Then was a visit 2 after 2 weeks and a visit 3 after 1 month, with each time COMI score, growth, and quality of life. And what did it show us? Well, after 2 weeks, the total COMI score decreased for both groups, mainly due to the reduced crying and improved stools. And infants fed the goat's milk formula showed a trend to get faster improvement of the gastrointestinal discomfort as compared to the cow's milk formula with the probiotics. So what it shows you here that after 1 month, there is no statistical difference anymore between both groups. At the beginning, they are completely equal, but the improvement goes much faster with the goat's milk-based infant formula. And of course, rapidity of improvement of symptoms is important for the quality of life, because the mother will be very happy if that crying and distress decreases relatively fast. The faster it improves, the more impact you will have. So, better digestibility of the goat's milk protein compared to the cow's milk protein. So why goat's milk? Well, the natural composition of goat's milk is closer to the composition than cow's milk. So cow's milk requires significant modification in order to manufacture a humanized infant formula. And so human milk breastfeeding is absolutely the best way to feed all infants. But the composition of the goat's milk seems to be somehow closer to the composition of mother's milk than the composition of cow's milk. And if you look in more detail in the protein composition, the goat's milk casein profile is more similar to that of human milk. And goat milk has lower AS1 casein levels than cow's milk, producing softer and looser curds which are more easily digestible. So the milk casein composition of goat's milk is closer to that of mother's milk, which results in a more similar gastric emptying of goat's milk to mother's milk than cow's milk has to mother's milk. The goat's milk-based infant formula has a complete amino acid profile. It has an adjusted whey casein ratio to mimic human milk. And the research showed that whey-fortified goat's milk infant formula had lower extent of coagulation and is therefore easier to digest than non-adapted goat's milk infant formula. Additional whey is beneficial for the immune system. So whey proteins naturally contains many unique components such as lactoferrin, alpha-lactalbumin and osteopontin. And these components have multiple functional benefits as shown. So whey proteins enhance the utilization of minerals such as calcium and iron and vitamin D. They stimulate the development of the immune system. They promote the growth of beneficial bacteria. They are a source of essential amino acids, and they have also antiviral effects and so protect against infections. The protein digestion of goat's milk infant formula, as illustrated here on this slide, is closer to that of human milk than cow's milk. So in this study, what was done is a comparability between digestibility of goat's milk infant formula and cow's milk infant formula with breast milk as the reference. And so the conclusion was, compared to cow's milk infant formula, the kinetics of protein digestion of goat's milk infant formula is more comparable to that of human milk. 72% of the doctors mentioned a better protein digestibility of goat milk formula compared to cow's milk. Now, another aspect is the levels of oligosaccharides. If lactose is the most important component of mother's milk, human milk oligosaccharides are the third most important component in mother's milk, and the human milk oligosaccharides are responsible for the development of a well-balanced gastrointestinal microbiota, rich in bifidobacteria, which is very important to stimulate the development of a well-balanced immune system. And what is now the case for the oligosaccharides is that in goat's milk there are 6 times more oligosaccharides present than in cow's milk. The diversity of the goat milk oligosaccharide is greater than that of cow's milk. In cow's milk the oligosaccharides are almost virtually absent. And so the diversity of the goat's milk oligosaccharides are more closely to the diversity of the human milk oligosaccharides. And the goat's milk contains, among others, 5 oligosaccharides that are identical to those found in human milk. And if you look at that compared to cow's milk-based infant formula, where now 2 oligosaccharides, 2 human milk oligosaccharides are added to the cow's milk-based infant formula. In goat's milk, you have 5 identical oligosaccharides present. So the beneficial role of goat's milk infant formula is that goat's milk formula is developed also for healthy infants. It's not only for those with functional gastrointestinal disorders, of course. Healthy infants do as well with goat's milk-based infant formula. The specific and favorable nutritional profile of goat's milk formula, however, may offer a suitable alternative for infants perceiving cow's milk-related intolerance, but again, not lactose intolerance or gastrointestinal symptoms associated with the ingestion of cow's milk. What brings me to conclusion. There's a need for the physicians to improve the knowledge on cow's milk allergy versus cow's milk intolerance, to become more aware of this issue, to better understand both different mechanisms and to better diagnose and manage them. There is a need for more research to support the use of goat's milk infant formula in the management of cow's milk intolerance, and there is a need to create more awareness on the beneficial potential of goat's milk-based infant formula. So goat's milk formula offers a viable alternative to extensively hydrolyzed formulas or amino acid-based formula in those infants with cow's milk intolerance, not in those with cow's milk allergy, of course, or with lactose intolerance, but with cow's milk intolerance and gastrointestinal symptoms associated with cow's milk allergy. There is a role for goat's milk-based infant formula in that management. And so you have seen this slide before, but what could then happen is that if there is cow's milk intolerance, you don't need the extensive hydrolysate. You don't need the amino acid-based formula. So you could then use goat's milk-based infant formula. But in case of cow's milk allergy, do not use the goat's milk infant formula. Use the extensive hydrolysate or amino acid-based formula, because goat's milk-based infant formula is not sufficiently effective in the management of cow's milk allergy, while it has a place in the management of functional gastrointestinal disorders or whenever there are non-immune mediated gastrointestinal symptoms. And with this last slide, I would like to thank you for your attention.
Thank you very much for this nice overview and presentation.
Thank you.
I would like to invite you to the table to discuss a little bit further on the future directions of the paper. As you mentioned, there are many infants who are suffering from GI-related symptoms. Could you explain how this publication could help these infants that are suffering from this kind of complaints?
Well, the intention of the paper is 2 sides. One is just acquiring the information how those infants are handled today. At the same time, the paper discusses the pros and cons of that actual management. And so at the same time, there is a discussion on how that management and that awareness could be improved for the future. So it's at the same time making recommendations to get our colleagues, our healthcare professionals in the region more aware about the difference between functional symptom, digestive problems, and allergic mechanisms, where there is now a lot of confusion. And it's true, it's certainly not easy to recognize them, but it's only by better awareness and with using tools like ComIScore, which could help them to better differentiate them those. And don't forget about the prevalence, 5% compared to 50%.
I was a bit surprised by the outcome of the survey, but according to you, as being an expert in the field, were the most striking results of the survey?
Well, I think that the most striking results are when but that's true, I think, worldwide, that amongst primary healthcare professionals, the diagnosis of cow's milk allergy and intolerance is still a major issue because of the difficulties, because there is no specific symptom and there is no clear diagnostic test for the majority of the infants. And so it's a gray zone, and it's by using help and diagnostic tools and taking a complete history and tools like ComIScore that we try to increase that awareness. Because today we discussed only allergy versus intolerance, but crying babies are very often treated also with proton pump inhibitors, which is not recommended at all. So it goes discussion beyond the allergy or just nutritional. It's also drug treatment, which is overused in this kind of infants. And so at the same time, the other side is try to educate healthcare professionals that there are nutritional solutions for these digestive problems, which do not always need expensive formulas like extensive hydrolysate and amino acid-based formula, because also this was not discussed, but let's not forget that this kind of therapeutic formulas are quite expensive.
Yes.
And if they are prescribed unnecessary, if there is an adequate management which is cheaper, that's something to make our colleagues aware of. And goat's milk-based infant formula does have a place there.
Yes, I agree with you. And elaborating a little bit more about the diagnostic tools, do you foresee in the near future just a tool that may help the healthcare professionals to discriminate a bit better between CMA and CMI?
I'm afraid not. I think that what we try to do is increase awareness. But I do not think that artificial intelligence, a questionnaire or whatever, will ever make clear-cut difference between both conditions. I think that the complete image of the infant, by which I mean history, symptoms, complete physical examination, the whole picture together needs a decision of a healthcare professional, which need to be more aware and better trained than today. And that's why we need those awareness tools to increase the awareness, because now often an infant presenting with crying, presenting with reflux, presented with constipation, all these symptoms are treated separately. And I think for functional gastrointestinal disorders, the majority of the infants present with a combination of those symptoms. And that's why the awareness tool is important. It brings all those symptoms together to a certain score, and if you go over that level, then the likelihood becomes higher of intolerance or of allergy, but it's only about likelihood, it's not diagnosis.
I see. Thank you.
Yes, and if I may ask, of course these results are done in the MENA region. What would you expect when we would repeat this research? Would we find other results in other countries? What's your feeling about that?
Well, the scientist always answers, then you have to do it. But my speculation would be that you will find similar results, and that worldwide the healthcare professional has problems of awareness of those symptoms and how to separate them. In the United Kingdom, for instance, there are data that parents need to go 6 or 7 times on consultation before the healthcare professional thinks, well, this might be allergy. While in other countries, doctors think often too fast that this is allergy, and so there is as well over and under diagnosis, and the awareness tool is there to try to avoid the extremes. Let's begin with that of the over and under diagnosis, because not diagnosing cow's milk allergy results in failure to thrive, but overdiagnosis of cow's milk allergy also has negative consequences because of high cost, because of influences on taste and what those children eat later, and because of unnecessary anxiousness about allergy and atopic march. So as well over as underdiagnosis need to be avoided as much as possible.
Yeah, clear. It's all about the balance.
Yes.
Clear. So I think with this we have a nice end of this session today. But of course, not before I would like to thank all the involved stakeholders in this whole process. So I would like to give a special thank you to the EAP, who has done so much work in whole the organization and execution of the survey. Of course, we would also like to thank the healthcare professionals that support us with filling in the survey questionnaire. And last but not least, I would give a warm thanks to you, Professor van der Plas. We highly appreciate that you joined us today. But of course, I would also like to thank you for your high engagement during the whole process and supporting this whole study. So thank you very much.
Thank you.
So, are you curious about the whole paper? Then, of course, it's available on our Aus Nutria Nutrition Institute. And next to this, of course, there's also all kinds of publication available about the science behind goat milk formula. So, at the end of this session, you could read the website of our Aus Nutria Institute to learn everything about our product. With this, I would like to thank you for your attention and wish you a very nice day.